Practice integrative medicine. My goal was always to bring in lots of different services under one roof so that it could be a total wellness experience for patients when they come. When I work with patients, I really am sort of like a detective, and you'll see as we talk about heart health tonight kind of how that functions. But spending time with the patient, really listening to their story and listening to the things that may be out of balance, the goals for their health. You know, what can we do today to prevent things down the line, to really focus on optimizing their health and preventing disease and keeping them that way. So I'm going to do a lecture tonight on heart health. We're going to learn about how important stress relief is for the heart, and then we're going to get to actually experience it. So I'm very excited. So leaky heart, I mean, who here in the room has heard of leaky gut? Sure. Right. Leaky brain? Starting to hear about that, right? Because we're learning with research that the gut is very intimately connected with the brain, so that if you have a leaky gut, a lot of times you'll experience what we call leaky brain, which is, could be anxiety, could be brain fog, depression, some neurologic symptoms, and they kind of go hand in hand. Most of the neurochemicals are in the gut. So when you think about anxiety, we think about the brain and the neurochemicals, but a lot of times when people experience, say, irritable bowel or leaky gut, they'll experience neurologic symptoms like anxiety or depression, and when you heal their gut, those symptoms magically go away, which is always a nice, exciting thing for people. So, you know, why any disease? When we think about, from an integrative medicine standpoint, when we think about disease, I think of it as kind of dis-ease, what's out of balance in the body, right? We think about nutrition, we think about stress relief. I spent most of my career practicing very conventional medicine, and it wasn't really until a family member got sick, actually 3 family members got sick, and when you're a family member, it doesn't matter what your training is, you go searching for answers, because somebody you love is in need. So I started reading all these books on integrative medicine, and I was like, what is this? I didn't learn any of this. I didn't learn about nutrition at all. Nobody taught me to think about why did somebody get sick? You know, what's going on that led to this disease, and what to do about it. I had no knowledge about stress and the connection to disease. So this is the model and the training that most of your medical practitioners are coming from. And I'll tell you from my own experience, when I read these books, I went, this makes sense. This makes a lot of sense. And I got mad that I hadn't learned it. And then you get a little, you kind of have to go through a dark night of your soul, where you have to reconcile your training, your beliefs, everything you've practiced, and this new information. So I always say be patient with practitioners, because it's really a challenge to make this leap. And most of us in this field have either been sick ourselves or have somebody that we care about that allowed us to open our minds and kind of see this new world. So when we think about disease, no matter what anybody comes in to see me for, I think about what are the root causes, right? And that's true for heart disease as well. So looking at the root cause, we don't treat disease, but we treat the causes and we treat the person so that the body can heal, right? Inflammation is at the root of pretty much all disease. I would say cancer has a solid root in inflammation, heart disease. We now know that a lot of dementia and Alzheimer's. Come on in, make yourself comfortable, don't worry. Thank you. So we think about all this inflammation. We're going to talk a lot tonight about autoimmune disease. 1 in 3 Americans are destined to get an autoimmune disease in the next 5 years. And I'm going to show you statistics tonight that are going to kind of blow your mind. I see it 3 times a day, if not more, right? Not even just, you know, I would say every patient is coming in with either an autoimmune disease, maybe more than one autoimmune disease, and if not, signs that they're headed towards an autoimmune disease. And that's really when you want to catch that. So you have to ask yourself why. Why are we seeing so much in this country? We're not seeing this in other countries, right? Gluten, dairy, soy, GMOs, toxins, sugar. These are all the things that we didn't have this 20 years ago, right? We didn't have all these insults into our physical beings, and so as a result of that, we're seeing a lot more disease. So that's really, I think, why the rates are rocketing. So heart health, you know, we think about inflammation. For a long time, all anybody thought about was cholesterol, and we've sort of beat that myth, and we've decided, oh wow, it wasn't really cholesterol that time, right? Cholesterol is a factor. Inflammation is big, right? Inflammation is huge. Plaques in your arteries, right? So why are people getting plaques? Is there, you know, these are tests that everybody always got, lipids, cholesterol, right? Homocysteine and CRP are all you read about in the cardiac literature right now, right? This is a measure for plaque formation, like at risk for plaques, This is a measure of inflammation. So I know when somebody comes in, their complaints are inflammatory, but this number will tell me how hot is that fire, how much is that risk factor. And there's a direct correlation with a high CRP and risk for heart attack and stroke. So that's something you want to know about before it happens, you know? So if you go to your doctor, you can ask for these tests. They're covered by insurance, and any doctor can do them. MTHFR gene mutation, we're going to talk a little bit about that, but that's one of the genes that can increase risk for heart disease. Sadness, grief, loneliness, I have a whole little section on this. Has anybody ever heard of broken heart syndrome? Mm-hmm. Right? It's literally your broken heart from loss, grief, can actually cause congestive heart failure, cardiomyopathy, where you're literally in heart failure because your heart is broken, right? So what can we do when somebody goes through a loss like that? We've got to get them support. We've got to get them some counseling. We've got to get them doing meditation and heart openers and yoga and all of the things that will allow them to let go of that grief so it doesn't result in any kind of disease in that. Blood pressure, obviously, is very important. What can go into high blood pressure? Stress, genetics, diet, lack of exercise. Sleep apnea is very, very important. It's very underreported. If your husband or your wife snores, have them get it checked out, right? Snoring, and then has anybody experienced sleep apnea where they kind of sound like they stop breathing? You know, so wives will tell me like, yeah, he does this, and he stops, and I have to kick him, right? That's sleep apnea. That's putting strain on your heart. That's increasing your blood pressure. That's giving you literally no oxygen to your brain. When you do a sleep study, they're going to literally tell you how many times you stop breathing and how low your oxygen goes. It's kind of scary when people find out, wow, my oxygen's dropping to 60 15 times at night, right? So you want to address that. And then when you get the test done, you want to listen to the doctor's instructions, right? So a lot of people get recommended a CPAP mask, and it can be uncomfortable. Who wants to sleep with the mask on their face? But if you don't, I mean, my father passed away from sleep apnea. So I feel very strongly about sleep apnea, and I feel a lot of people don't really think of it as a serious medical concern, and it really, really can be. So share that with your loved ones. Lack of exercise, obviously a body in motion stays in motion. So for cardiac, exercise gets a lot of hype, right? There's a lot of research. Everybody sort of knows I'm exercising, I'm doing my cardio for my heart. Exercise is really important for cancer prevention. It's important for brain health. It's important for so many, and I think just literally a body in motion really stays in motion. So when I take care of, my oldest patient is 99 years old, and I have another patient who's 89 years old, and these guys they're doing amazing, and I will tell you they all do something for their stress on a daily basis. They all exercise, and they all have wonderful relationships. So those will be the three common denominators that I think are very important for us to feel great when we're 99. Nutritional deficiency, we're going to talk a lot about this tonight, but omega fatty acids, methylated B vitamins, toxins. If you know me, I like to talk a lot about toxins because it has an effect absolutely on every aspect of your health. And we'll talk a little bit about that. And then my favorite topic, stress, which we're going to get rid of all tonight when we do our meditation. A lot of pressure. So autoimmune disease, right? So 50 million Americans have an autoimmune disease. 509, these statistics, actually, when I looked them up, I was a little bit shocked, honestly. I didn't know the dollar amounts that went into treating autoimmune disease. $591 million spent by the NIH on autoimmune research, right? As opposed to $6.1 billion on cancer. Isn't that interesting, the difference? Number one most popular health topic when people call in for the National Women's Health Information Center. So the NIH says that it's 23 million, and you notice on the other slide that this organization says it's more like 50 million. It's very underreported, and that's because they will only talk about the conditions that have statistically significant research behind them. And we're going to get into the amounts of autoimmune disease that we actually know are here. So a lot of money is going into this. A lot of money is being spent on this country. I foresee that getting a lot higher in the next 10 to 15 years. So the researchers have identified 80 to 100 different conditions. So some of them are like Hashimoto's, rheumatoid arthritis, MS. These are all things we hear a lot. there are suspected to be at least 40 additional diseases that have not been officially named yet, right? So when I look at my patients, I'm looking at any signs, first of all, risk factors of autoimmune disease, and then signs that they may be heading towards. And one of the conditions we're going to talk to you about tonight is actually an autoimmune cardiomyopathy, which is that heart failure that's actually autoimmune in cause, right? And that's one that's just starting to be talked about. It's not one that's statistically got all this evidence behind it yet, but yet people are ending up in heart failure from autoimmune disease, right? Closer genetic relationships exist, so families tend to have autoimmune disease run in their families, right? So not that it's genetic per se, but you grew up in the same place, you kind of ate the same foods, you learned how to handle stress from your parents, right? So those are the factors that kind of go into why it runs in families. And then there is some genetic predispositions can increase the likelihood. Like, for example, celiac disease is an autoimmune disease, and if a family has celiac in their genetic lines, they're more at risk for other autoimmune diseases, so that's stuff that we look at as well. So the treatments for autoimmune diseases really are not great. They're immunosuppressant therapies, right? So the mentality in conventional medicine is that the immune system is hyperactivated, so we're going to suppress the immune system. So you can imagine the side effects of suppressing the immune system. People get sick more, they can get very, very sick from a common cold, and they're higher likelihood of getting cancer. So obviously we don't want to have to do that unless we absolutely have to. And I find that with the right diet, exercise, supplements, and detoxification, 90% of the patients with autoimmune disease are in remission within a few months in stress relief. Never forget the stress relief, right? So there isn't any pill for that. We really have to get people to participate in that stress relief, but it is a foundational part of the treatment plan. But imagine, would you want to take an immunosuppressant for the rest of your life, or would you want to just make a few changes and see your body heal itself, right? Symptoms, so the problems, the critical obstacles, I mean, I think for celiac disease, the statistics are you see 12 doctors before you get an official diagnosis. I had a patient last week with Hashimoto's. A year and a half, this poor girl, 20-something-year-old, didn't feel like she could get out of bed, knew something was wrong. That's the thing I hear all the time. I told them I didn't feel good. Nobody listened to me, right? And that's a big problem, I think, in the diagnosis of these diseases, because there's no, hey, you have Hashimoto's where you're going to have X, Y, and Z. I can't check the boxes and go, oh, she fits in this box. It's different for everybody. So you really, you know, if I'm in a conventional medical practice and I only have 4 to 6 minutes to spend with you, can I really gather that information to be able to help you? Probably not. So that's another limiting factor. Medical education is not, it's really just, okay, you have a hyper immune system, we're going to just put it on an immune suppressant. That's like the mentality in medicine. It's, again, remember, we don't ask why. We don't get taught to ask why somebody's sick. So if we don't know nutrition and stress relief, it's very hard to actually get somebody to go into remission and be better. Initial symptoms are usually on and off. So when you first start getting this, it's subtle. It's not like, boom, I don't feel good, I'm sick. It's, I don't feel good, I have less energy. My hair is starting to fall out, you know, my nails are brittle. It's very subtle sort of symptoms. And so when you go to the doctor, they only have time to really ask you a few questions and write a prescription. So they're not going to really, you can't fit in the box, there's no prescription, you just kind of keep getting sicker and sicker because there's no answers. And a lot of people, that's their story. So the idiopathic dilated cardiomyopathy, that's the heart failure, okay? Idiopathic in medicine means we have no idea why. So there's a lot of things that are, do we just say idiopathic? If we can't find the cure, that's what the accepted terminology is, idiopathic. And this is, it's not, I think the levels are being reported are lower because I don't think anybody thinks about this, right? So I think they don't think about why. Okay, it's not your heart, you're going to do a cardiac cath, you're going to make sure it's not vessel disease, you're going to put them on a cholesterol medication, right? And then you're going to send them out the door with some blood pressure medications so their heart recovers. But nobody's really saying, well, maybe this is an autoimmune process, and let me help this patient find those those causes. So leaky gut can lead to leaky brain and leaky heart, right? So we got to go back to the basics. Now, this was only 3 studies that I could find on this out of 25 studies that were cited in that prior article. So there's a lot being written about this, okay? But it's probably the last thing that crosses a cardiologist's mind when you show up in the hospital with heart failure. And that's That's not going to do the patient any favors. So we've got this idiopathic cardiomyopathy that's autoimmune, which is one of the autoimmune diseases. Then we also have, I'm never going to say this right, but Takasumbo, I don't think I butchered that, cardiomyopathy, which is broken heart syndrome. And there's a book written about this by Mimi Guarneri. She's a wonderful integrative cardiologist out in, of course, California, where everybody's getting to party out in California. But she wrote a whole book about it, and I feel like she wrote the book because I think one of her family members suffered this. And it's really significant. Very often people will go present with chest pain that think they're having a heart attack. They'll go to the hospital. Again, they'll see that the heart is not functioning, it's in failure. They'll do all the things. We do cardiac cath to make sure there's no blood, vessel disease. We look at, do they have high cholesterol? Do they have high blood pressure? And a lot of people, leave the hospital not knowing that the reason for their heart failure is their broken heart. So they're not referred to get counseling. They're not referred to a community for grief support. They're not kind of reminded that, hey, maybe I got this heart failure because I need help, healing my heart so that it can actually recover. And that really is the treatment for this cardiomyopathy, is grief therapy, is helping that patient get over that loss. And it's, there's no prescription for that, right? So it's caused by acute stress or usually grief. And the things that can really help are obviously things that are going to help them deal with the stress. Breath work, Reiki, grief counseling, support groups, massage, meditation, hugs. I'm a big fan of hugs. I think they're very, very healing. Some of the best medicine around here. Thermography. So thermography is a tool that I use. We use in the practice all the time. The best thing I could say is, you've heard the expression, a picture's worth 1,000 words. Well, that's thermography for me, right? If somebody takes a picture of their whole body and I get to see all the inflammatory patterns in their entire body, that's like, okay, now I got to figure out what's causing all that, but we know what's going on, right? So we listen to the story, we do a physical exam, we do an extensive lab work, but we try to do thermography on as many patients, and we'll have some, you can do your arm or do your neck, or you can experience it after the lecture tonight. If you've never seen thermography, it's kind of neat to see a part of your body. But it really helps me construct a snapshot of what's going on and where those risk factors are. This is a picture of a color thermography, so we can see everything. So we can see sinus inflammation, we can see dental abscesses. I probably picked up a dozen dental abscesses that patients didn't know they have, which are big risk factors for heart disease, okay? Hypothyroidism will show up as a cold spot. If you have nodules and they happen to be hot, they might show up on the thermography. We can see goiters, we can see hyperthyroidism. We can see carotid artery inflammation at 5 to 10%. Now, if you go for a carotid duplex, which is the standard test, it's considered normal if it's less than 50% blockage. I don't want to be 50% blocked.
Oh, wow.
I want to find out when it's 15% blocked and then change my diet and take a fish oil and, you can reverse heart disease with diet and exercise. I didn't put a slide up here, but Dean Ornish, anybody heard of Dean Ornish? Big doc in integrative medicine. He's been doing it since before it was cool. And he did the most research in reversing heart disease with an integrative approach. And what his program was the Mediterranean diet, yoga, and meditation. And what he did was he took patients that just had a heart attack, and he did the scans, and he showed the blockage. And they put them on this 90-day program of literally learning how to eat, Mediterranean diet, yoga, and meditation. He did a CAT scan, and he showed that the blockages were gone. This man did so many people that Medicare will cover his program as acute cardiac rehab for somebody who had a heart attack.
That's awesome.
Now, when he took out the yoga or the meditation, you needed both. It didn't work. So that is huge. Wow. Huge. And so you want to find out about heart disease early. We know that if we put somebody on a good heart-healthy diet and we get them stress relief and some good fish oils, we can turn those blockages around, especially if we catch them early. What else we see? So it's most known for breast thermography. So it's very different than your mammogram or your sonogram. That's a test of anatomy, even your MRIs. It's going to tell me if there is the tumor, where the tumor is. This is a test that's going to tell me your risks for your breast, right? Are they dense? Is the right breast more dense than the left breast? And if there's any areas that blood vessels are going to, we could see at 6 to 8 years before it's going to show up on a mammogram. Wow. So that's when I want to find it, right? When it's just some blood vessels maybe feeding some random cells in the middle, and then we put you on a protocol, we bring you back, and we make sure that the pattern has gone away, and then you come once a year. I dream of a time where every woman starts this at 25 years old, because between 25 and 40, we don't do anything to prevent the disease. And we all live in Long Island, right? So we all have to be proactive about breast health, but this is an amazing tool. And then the gut is, I have another picture of the gut that we can see is the colon that's inflamed, is the pancreas inflamed, is the liver congested. We can see heartburn like nobody's business. It's unbelievable. I'm like, you have heartburn? No. I'm like, yep, you have heartburn. Silent heartburn, but you have heartburn, right? So joint issues, obviously. I mean, it's just amazing what you can see. And I've had patients that come to me and, they've been to 5 or 6 doctors. They feel awful. Nobody, I can't tell you how many people are told, go see a psychiatrist. You need therapy. Right? I take the picture, I show them, okay, so you're hurting here, you're hurting here. They start crying because it's so validating to have a test that shows where you're hurting, and not all of the other tests do that. I had a patient who had, I call it the $1 million workup. She had MRIs, CAT scans, endoscopies, colonoscopies, you name it. They'd looked at every part of this woman. She was not okay. And this showed everything. And we got her better. I mean, she did great within not a very short period of time. So knowledge is power. I feel like the more tools we have in our toolbox, the better we are, better prepared we are to protect our health. And people will say, I'm afraid of what you're going to find. I'm like, no, don't be afraid. If we know, we can fix it. If we don't know, that's what scares me, is what I don't know about a patient. So you really want to know your genetic risks. Genetic testing is becoming a lot more mainstream, and it really is helpful because I always say genes load the gun, but environment pulls the trigger. Right? I know I have genetic risks for diabetes. I don't eat sugar, I don't eat carbs, I exercise. I will not get diabetes. I know it in my heart and soul, right? But if you know what your risks are, that's empowering, because I wouldn't have maybe tried so hard if I didn't know that I was at risk for diabetes, right? Detoxify, we're going to talk a lot about this tonight. Food detox, sauna, cilantro, these are all things you can incorporate in. Organic, grass-fed, cage-free, non-GMO, really good food, right? So just try to source your food as carefully as you can. Feeding your genes, so if we know about your genetic risk, we can give you methylated B12, we can give you methylfolate, really good quality fish oils, organic foods. We'll talk a little bit about the cleanses that we do here, and then sleep. Sleep is really important. I mean, ask everybody, how do you sleep? 1 out of 20 say, great. I'm always like, wow, really? And then when I ask kids, do you have trouble falling asleep or staying asleep or both, right? So it's really important. If you're not getting a good night's sleep, it's very hard for your body to recover, okay? So the question is, that's always where I start with everybody is the leaky gut, right? So this is a thermography. It's not a great focus in this, but you can see the colon runs up here, comes across, and comes down, and then the small loops of bowel are sort of squished into the middle, and the loops that are pointing at the camera is what we're seeing, those little circles there. So this patient has gut inflammation kind of everywhere. And then you start to see, I think, what looks like heartburn up in here as well. I do think gluten is the devil. Come right out and say it. Gluten is a problem because we're taking wheat, we're spraying it with glucophosphate, which is Roundup, and we're feeding it to people. And the immune system is really, really smart. It's a lot smarter than we are, I think. And what it does is it sees wheat, poison. So eventually, everybody is going to react to that, right? It just makes sense. And that's going to create a whole cascade of problems for patients. And the gut is, for me, the foundation of the body, right? So that's where I start. No matter what anybody comes in with, we have to get your gut healthy, and then the rest will follow, okay? I love this cartoon. Like a crack in the foundation. Oh, dude, yeah, it's my leaky gut. So, I say it's like a leaky bucket, right? We could fill it with good stuff, but if we don't plug the holes, it's going to be like running on a treadmill, right? And it really is. It's where all your neurochemicals are, and that's going to control sleep, anxiety, depression. It's where all your nutrients are absorbed. So if you have a leaky gut, you're not absorbing your nutrients. You're going to get tired. You're going to get fatigued. You're going to have hair breakage. And B12, folate, iron, B6, these are the things I see low in all patients with a leaky gut. Immunity. This is where 80% of your immune system is. So I always tell my patients, that didn't come out very well, but your immune system is your homeland defense, okay? Do we want them like the Hulk with the machine gun? Or do we want them like little skinny little stick figures with a BB gun, or I told a patient this, I feel like these are water guns, right? They're your firefighters, right? So if you're taking a lot of GMO food or you're taking a lot of antibiotics, your immune system's just trying to protect you. And what it does is I call it the 3-alarm fire, right? There's a 3-alarm fire going on in your gut, and the alarms are going off, and it's smoky, and it's confusing, and your guys are all out there trying to put out the fire, right? This creates havoc in the body. This is what I feel is the root cause of all immune disease, right? All autoimmune disease. Because if those, what happens when you burn yourself in the kitchen? You're gonna get a little crack in the skin, right? So what happens if there's cracks in the gut? I think I have a diagram of that. Yeah, there it is, leaky gut. So what happens if there's cracks is that nutrients are supposed to go through, okay? Food particles are not supposed to go through into your bloodstream. That's not what your physiology wants. So when that food particles hit the bloodstream, your body goes, oh no, it's an invader. And now we have inflammation, right? So now your fire spread from your gut into your bloodstream. And remember, it's smoky and confusing. So why does the body react to the body? It just doesn't make sense, right? Why does my immune system get confused and react to my thyroid? Why does my immune system get confused and react to my brain, right? I believe it's because of this. And I think that's why we're seeing such high rates of autoimmune disease is, again, the GMOs. You know, the toxins in the grass. And the milkman used to bring the milk to my house in a glass bottle from the farm. My kids never saw that, right? So if we shift everything, like our great-grandparents, right? They never saw autoimmune disease, right? Grandparents, 1% of the population got diagnosed with celiac disease. That gene that's sitting there since, generations and generations ago never had to turn on until now. So that's why we're seeing such epidemic levels of autoimmune disease. And I believe it all starts here. So healthy gut, healthy everything. I really, really do believe that. So little things that you can implement right away is taking a good quality probiotic, and quality does matter when it comes to probiotics. Good oils, avocados, fish oils, cold pressed olive oils. I do shots of olive oil in my kitchen when I'm cooking, okay? And I'm a little bit of an olive oil snob because they're not all created equally, right? So I get the good Greek olive oil that's green in the glass bottle. Because if you look at, they're all different colors, right? And the ones that are yellow, there's a whole lot of crappy oils mixed in there. Olives are green, right? So good stuff makes a big difference. Cold press matters. So if I heat my olives, I'm losing a lot, just like when I cook it. When I cook with olive oil, I'll then pour a little bit of raw olive oil right on the sauteed spinach after. So you're still getting that raw olive oil. And when I detox people, we're literally doing shots of olive oil when we're going out of the sauna. Green smoothies, I'm a huge fan of green smoothies. Maybe we'll do that next one for our mocktail. A lot of fiber, plus you're putting all those leafy greens into the blender and you're pre-digesting it, right? So your body's going to get a lot more of those nutrients, especially when your leaky gut's not working so well. Checking for food sensitivities is really helpful, and colonoscopies are very important, right? There isn't really a good substitute yet. Hopefully there will be, but right now that's the only way for us to pick up early polyps so we don't let them become colon cancer. And listen to your body. I think as New Yorkers, we are taught to ignore our symptoms. You get a heartburn, you take a Tums. You get a headache, you take an Advil. You have joint pain, you take an Advil. This is your body just trying to tell you something's wrong. And if you listen to the pain, I have a headache, well, maybe I didn't drink enough water today. Let me correct that. My joints are hurting. Maybe something going on, Don't suppress the symptoms, just listen to the body. And I feel like that's sometimes really hard for people to learn how to do. So like I said, genes load the gun, but environment pulls the trigger. The genes do not determine your destiny. So please don't feel because, this is running in your family. A lot of people just like, it's going to happen. Everybody died at 40, I'm going to die at 40. That's just not true. Genes are only a piece of the puzzle. Environment has the greatest effect on genes. Food, toxins, nutrients, stress. These are the things that you are in complete control of. This was just one of many, many studies about how genes have to be expressed, and the environment around the genes make a big difference. Stress, gut health, pharmaceuticals absolutely affect our health, and then the chemicals. So the consequences: vitamin deficiencies, GI upset, neurochemical imbalances, immune suppression, low vitamin D, low B12, low folate, low iron, low vitamin C. When I first got into this field, I was like a naturalist. If we all do yoga and meditate and we eat right, we'll be fine. And it's just not true anymore, right? So when I look at the blood work and I have an organic chef in front of me who's doing yoga 3 times a week, and I'm like, wow, even she's deficient, right? She's eating, you know, from this organic food, and she's like, I'm not a great chef. She's an amazing chef. It's the farming, right? It's the soil. It's kind of an epidemic right now. And if you take a tomato from the United States and you take a tomato from Italy, it's like 40% less nutrients in our tomatoes. It's just a fact. If you look at, I recently saw something, I usually use the European example comparison, but if you took a vegetable from 50 years ago and you compared it to a vegetable from today, it's 40% less nutrients. So that's just like, it's a fact of life. And taking good quality supplements, I find, can make all the difference in keeping your nutrition good. So we might get through the day, but are we happy? And more importantly, are we healthy, right? So stress, studies suggest 60 to 90% of illnesses are stress related. I would disagree. I would say 99% have a root in stress. Stress is what, all of these things are creating weaknesses, but stress is normally what tips people over. I say, okay, you were walking a tightrope and then the wind blew, right? And that is something that, again, stress is not what kills you, it's your reaction. And as a former extremely type A, OCD, uptight New Yorker, I will tell you that yoga and meditation changed my entire life, my entire being, and my entire family. Because I'm a better mom, I'm a better wife. I don't sweat the silly stuff anymore, right? But it wasn't easy. I had to go to 4 yoga classes before I had that aha moment. I was doing the grocery list in my head. I was thinking about where the kids had to be. And I had this moment where I'm pretty sure it was the first time in my entire life, 'cause even as a little kid, I remember being 10 steps ahead, where I was like quiet and peaceful. And I walked out of that class literally in tears, and I went, I don't know what just happened, but I know I need more of that. And that's what I encourage my patients to find the tool. And it's like bliss. When you experience it, there is no comparison. And for most people, I think they're like me. I don't think they know what it feels like. Once you get hungry for it, the rest is easy. And it really does. It makes you shift your whole belief system, your whole perception, your whole view of the world. So how do we activate the body's natural response to stress, right? Relaxation response, we call it. And there's many books on this. So deep breathing, visualization, progressive muscle relaxation, meditation, yoga. Now it's so much easier. You can download an app to your phone. You can do it on the train on the way into work. You can do it, you can do deep breathing anywhere. I tell people, no, I don't have time. I don't have time. Okay, you're going to shower? Do you have to breathe in the shower? Okay, so I want you to take 10 deep belly breaths while you're washing your hair. It can be done, and they'll feel the difference. I had a 20-something who came to me with her mom, and she was like, this is ridiculous. I just don't have time. I'm like, she goes, I don't have time to breathe. And her and her mom kind of did one. We kind of smirked and looked at each other, and I said, just can you say that back out loud? Just listen to what you said. You got to breathe anyway. So making it a priority, scheduling in the activities, helping you stay calm, collected, because you never know when life's going to throw you a curveball, right? Unfortunately, I've had many curveballs come my way, and I will tell you the way that I handle them now with all my tools is much, much better than I used to handle them before. It really can help you get through really tough things. Vitamin D is something I wanted to touch on because everybody kind of thinks of it as the sunshine vitamin, which I really think it used to be. I used to tell people I'd give them 1,000, 2,000. I tell them go out in the sun for 10, 15 minutes, go to Florida a couple times in the winter, and I could keep everybody's levels in this really sweet spot, right? So between 70 and 100, they're actually saying, studies are suggesting maybe 80 to 100 is better for preventing cancer. But I could do that with 1,000 to 2,000 of vitamin D. The last 2 years, I'm giving people 5, 10, sometimes 15,000 of vitamin D, irregardless of sun exposure. So I've been witnessing this happen over the last 24 months, and I'm like, what is happening? What is happening? There's one study out of Israel where they documented that children in cities of pollution are not getting enough vitamin D, and they believe it's from the ozone, right? The pollution is kind of creating a filter, and the UVB rays are just not getting through. Now, everybody who walks through my door that is not taking vitamin D is very deficient. So ask your doctors to check your levels. Anybody can check it. The vitamin D2,5 hydroxy vitamin D is what you want to check, and you want to get your levels here. So your doctor, normal for the lab is 30 to 100. So if you're 30 to 70, as far as I'm concerned, you're low. So don't just accept you're okay, you're low, you're high. Ask the number and do the research, because that is where you want to be to help protect yourself. It's also going to help protect you from the flu, from viruses, right? It's really important for the immune system. It's also it's a pre-hormone, so it definitely is going to help keep your hormones healthy. And you should really get your levels checked twice a year. Because it's a fat-soluble vitamin, you can overdose. I've seen it like maybe 2 or 3 times ever. Not that they got sick, but their levels were over 100. Anti-inflammatory foods, everybody just eat a lot more of this, right? Avocados, walnuts, flaxseed, green tea, right? These are all things that are going to be healthy for your immune system. Food is medicine. So I had to show you guys this. We recently went to a conference, and this integrative cardiologist out of Arizona presented this food pyramid, and I was like, this is the best food pyramid I think I've ever seen. Because remember what the old pyramid was, right? It's all carbs. You're supposed to eat mostly carbs, right? And then I think fat was at the very top, right? You're supposed to have a tiny little bit of fat. So this is totally, nutrition science has completely flipped the whole thing. We were wrong. We were really, really wrong. And everybody's got weight problems, they're inflamed, they've got heart disease. Really had nothing to do with cholesterol, right? So try to be free range, try to be grass-fed, try to be organic, try to be local. And really fruit in season, right? So that's what, we didn't have supermarkets back in the day, right? So we ate fruit what was on the tree. We ate fruit that was out. And the fruit in season was because it was warm. So we were out in the sun, we were running, we were exercising, we were doing a lot more. We could burn off that sugar. So that's really important. Lots and lots of good fats, nuts and seeds. You know, meat got a bad rap back in the day. It's back on the good side of nutrition. And of course, the most is always vegetables. And try to make them organic. So the anti-inflammatory diet, if you know me, you know, I take bread and I say you got to break up with gluten and you got to break up with dairy. It's just like that's what we do. And the patients that do, and they stick with it, they never have setbacks. It's really pretty profound how it affects people. Toxins are sort of everywhere, so I'm sure you're all sort of shifting your environment to use less toxins, less chemicals in your products, you know, a little bit more organic naturals. You know, lipsticks used to have a lot of lead, still do, but people are starting to pull back from that. Perfumes have a lot of chemicals, cleaning supplies have a lot of chemicals, so the more you start to change your house over and protect yourself from literally getting exposed, and then doing a detox a couple times a year is going to be really helpful to actually get those chemicals that are there out. This is a great book. Anybody ever heard of this? Detoxify or Die? It's kind of old now. Sherry Rogers published this years ago, and it's literally 700 references on toxins and the effect it has on health. I think this book's got to be 15 and 20 years old, but she had all those medical studies cited that long ago, but yet we're still not talking about toxins in medicine. So you look at 9/11 is probably the most obvious toxic experience we've ever had in this country. God willing, we'll never have another one. But these poor rescue workers we don't even know the extent to which they were exposed, right? They were exposed to, we think, I don't know how they came up with this number, but 2,500 contaminants, from glass to lead to mercury to PCBs to petroleums from the fires that were burning underneath. And they got really, really sick. And a lot of them are still really, really sick. And, you know, they said, you know, obviously it was respiratory problems just because of the nature of the ash, sinus problems, asthma. A lot of them had pretty severe depression. At that point they said post-traumatic stress. But 10 years out, we were still saying post-traumatic stress. And we know that chemicals create depression and anxiety. You know, so we didn't address the chemicals, so we didn't really help these guys get better. And, you know, the consequences were lots of cancer, lots and lots of autoimmune disease. We're seeing really high incidence of thyroid cancer, which is we know directly related to toxic exposure. A lot of chronic, sinus. I've had people even recently come in and, you know, they're like, sinus for 10 years. I'm like, were you around 9/11? They don't think about it because they left and then they went back to work a few weeks later, but they were exposed. We were all sort of exposed. I had the privilege of working with some of these 9/11 rescue workers. It was about 6 years after 9/11, and I was hired to be the independent medical person who just came in and examined them before and after they did a sauna detox. So I did their pulmonary function tests and their blood work and examined them, and they would bawl their eyes out, and they would sit there and they go, I'm dying. Like, they all felt like they were dying. And then they went and they did exercise and supplements and sauna, and they bounced back in 20 to 40 days. and literally say to me, I feel like I'm 18. And I was like, what is happening here, right? And I had their before and afters. I had their labs where their triglycerides dropped 300 points. We didn't change their diet. These were rescue workers, firefighters, police officers. They were eating barbecue, right? Didn't change their diet, but their triglycerides dropped. Pulmonary functions improved, like, unbelievably. They lost weight. Again, we didn't change their diet. And I walked away from this experience going, if we can clean these guys, we all need to be doing this, which is why I'm so passionate about detoxification. What they did was intense, right? They were there 7 days a week, 4 or 5 hours a day. The average person doesn't need to do something like that. But if you start to implement every year doing a detox, getting in a sauna every chance you can, right? That's going to be what helps you get rid of. I mean, I used to sit in the conferences and cry because I poisoned my kids. I didn't know any of this when they were little, right? But I now know at least I can do something about it. I can help them get rid of these toxins and hopefully reduce risk. So sauna, I'm a huge fan. Anybody fan of sauna? Dry sauna makes you sweat, right? It's really the key is sweating. Far infrared does penetrate more deeply, but I don't care. If it's a dry sauna and you're sweating, it's doing its job. Obviously eating good detox foods, juicing, green smoothies, these are all the things we do. So drinking clean water, drinking tea instead of coffee, eating breakfast, eating clean, good fats, deep rest before you chew, before you eat your meals, exercise. I keep saying quality supplements, so this is big because the supplement industry is not regulated. So be careful. A lot of people are spending, it's $1 billion industry right now, and there is no quality standards. The GNC doesn't care. If you walk out with a bottle, they've done their job. You have to take supplements that change your levels, that you should feel better. If you're taking something that's working for you, you should feel a difference. I use the Zymogen brand. I think you guys are getting little samples of that tonight to take home. But I've toured the factory, I've seen their quality standards. They have 35 scientists on staff. They check the raw ingredient before they let it into the factory. They check every 100th pill to make sure it hasn't been contaminated and the finished product. When I went and I toured, I said, I can't use all these little companies. There's no way they have the capacity to make sure that my products are safe. For me, it's not about selling a bottle. I gotta get you better. If I don't get you better, I didn't do my job, right? You're not going to tell your friends to come and see me, right? It's not going to happen, right? So that is really, quality is very, very important. And I have had people get mercury poisoning from fish oils. Costco had a lawsuit, class action lawsuit against them. It's got to be a long time ago now, 8-10 years, because they were taking the fish oils from tuna. And tuna has a lot of mercury. So, it's really important to do your homework, do your research, and make sure you have quality supplements. Sleeping, and then detox. So next month, our Healthy Happy Hour is going to be on the detox. So you should all come back and see us. But I created the Man Up Detox and the Girlfriend Cleanser, kind of my programs, where I put you on a little program. You get a recipe list, you get grocery ideas, you get the supplements, everything's kind of in this. But I wanted to go home with my patients because I wanted to teach them how to stay clean. I don't want to just give you quick results and then 2 months later you feel the same. I want to make sure we know how to keep you healthy and then also how to detox, because I think there's a lot of fad, really crap on the market. There's a lot of bad information out there. If you're doing this right, there is no detox reaction, right? Your body tells you, I'm feeling bad, we're doing something wrong. You should feel great, You should sleep better, your libido should go up. Everything should move in the right direction if you're doing it right. So I wanted my patients to have that information. So it's a 21 days with me coming home with you. So my super toolbox. So all of what I talked about so far is kind of the foundation, the basics of what I believe it takes to be healthy. But in this practice, what we've brought in is the big guns, because we get a lot of really, really sick patients. And unfortunately, we're seeing younger and younger sick patients. So we do vitamin drips, which is intravenous vitamin C. You may take 1,000 in a pill, but this has got 25,000. And what it does is it goes right to your adrenal glands and right to your immune system, and it helps me get somebody who's really sick much quicker, right? IV glutathione is my secret weapon for anti-aging. It also is really good for preventing cancer and Parkinson's disease. The Beamer mat, which you guys can try tonight, it's our new PEMF device. It's in the room to the left. Has anybody heard of PEMF or Beamer? It's really not popular in the New York area. It's like starting to get popular throughout the entire country. I don't know why. I've heard of it, right? It's late to get here, but what it does is it increases circulation at the micro level, and increases oxygenation. So if you go next door, it's an 8-minute treatment. You can try it, and the girls will show you a little video of the before and after of the microcirculation and how incredible it is, how 8 minutes can change that. So microcirculation is bringing oxygen, and it's taking away toxins, and it's really, really good for inflammation. So, you know, those are 3 of the basics we've basically been talking about all night. My biomat is my secret weapon for stress relief, and you guys can go and try that. Hyperbaric oxygen. So we don't have a hyperbaric oxygen, but we have a relationship with the hyperbaric chambers in Woodbury, and I've been lucky enough to have a lot of patients in common with them, and so I'm getting to see the results of what we do in integrative medicine, adding hyperbaric oxygen to that, and it's been miraculous. You know, we did a study on MS with 3 patients, very, very young women, acute, very sudden onset of MS. Within 2 to 3 weeks, they were asymptomatic and have remained asymptomatic for several months, almost, it's got to be 6 months, 9 months now. So hyperbaric oxygen, you're getting dived under pressure, 100% oxygen. And that is, it's going to be great for everything. Again, oxygenation, increasing circulation. It's great for traumatic brain injury, strokes, wounds heal much quicker. Cold laser is another tool that we use here for pain. Basically, it's an anti-inflammatory light, so you can shine it on, a fracture. My son had a stress fracture. We use cold laser and the PEMF, so both of them. And he's a runner, and it was a tibia stress fracture, and he was trying to get recruited to college, so it was a big deal. 3 weeks he was running. Stress fracture should take 6 weeks, and we've had several other gymnasts that had the same experience. Yes?
You skipped over cancer, TIA. What is that, please?
Oh, transient ischemic attack. So TIAs are like little mini strokes. They're not full strokes, but similar symptoms. And then thermography, which we talked about, obviously gives me all my information. So basically, I feel like we're all sort of trying to protect ourselves from the perfect storm, which is, it puts us at risk for getting ill. And I think that all of the things we talked about tonight, and I know the experience that you're going to have with the meditation, are all things that are a valuable part of my toolbox and how to help my patients, myself, my children, my family. So I hope that you learned a lot. I hope that you had a great time.